Welcome to Storage and Delivery of Medical Gases, Part 1. This is Part 1 of a three-part series based on Chapter 41 from Egan's. The hospital oxygen service is the origin from which the current technology-laden field of respiratory care has evolved. Although RTs have assumed many more challenging duties, ensuring the safe and uninterrupted supply of medical gases remains a vital function. There are many commercially produced gases, but only a few are used medically. Medical gases are classified in three ways: as laboratory gases, therapeutic gases, or anesthetic gases. Laboratory gases are used for equipment calibration and diagnostic testing. Nitrogen, helium, and carbon dioxide are examples of laboratory gases. Therapeutic gases are used to relieve symptoms and improve oxygenation of patients with hypoxemia. Medical-grade air, oxygen, heliox, carbon dioxide, oxygen, and nitric oxide are examples of therapeutic gases. Anesthetic gases are combined with oxygen to provide anesthesia during surgery. Nitrous oxide, or laughing gas, is an example of an anesthetic gas. It is important for RTs to be familiar with all aspects of gases used in the clinical setting, especially the chemical symbols, physical characteristics, ability to support life, and fire risk. Fire risk of medical compressed gases is their classification. They are classified as either non-flammable or flammable. Non-flammable is classified in two ways: either non-flammable, does not burn, or non-flammable but supportive of combustion. Supportive of combustion can also be called oxidizing. Flammable means that a gas burns readily and is potentially explosive. Let's start with talking about oxygen. Oxygen is colorless, odorless, transparent, and tasteless. It exists naturally as free molecular O2 and as a component of a host of different chemical compounds. Oxygen will bind to anything, just saying. At standard temperature, pressure, and dry, STPD, oxygen has a density of 1.429 grams per liter. It is slightly heavier than air. Air is 1.29 grams per liter. Oxygen is not very soluble in water. And at room temperature and 1 atmospheric pressure, only 3.3 mils of oxygen will dissolve in 100 milliliters of water. Oxygen is classified as non-flammable, but it greatly accelerates combustion. Burning speed increases with either an increase in oxygen percentage at a fixed total pressure or an increase in total pressure at a constant gas concentration. Both oxygen concentration and partial pressure influence the rate of burning. Oxygen production. Oxygen is produced through one of several methods. Chemical methods for producing very small quantities of oxygen include electrolysis of water and decomposition of sodium nitrate, pictured here. Most large quantities of medical oxygen are produced by fractional distillation of atmospheric air. Small quantities of concentrated oxygen are produced by physical separation of oxygen from air. Fractional distillation. Fractional distillation is the most common and least expensive method to produce large quantities of oxygen. First, atmospheric air is filtered to remove pollutants, water, and carbon dioxide. Then the purified air is liquefied by compression and cooled by rapid expansion. This is called the Joule-Thomson effect. This results in a mixture that is heated slowly to allow the nitrogen to boil off and leaves just the O2. Let's talk a bit about the two different methods of physical separation. One is a molecular sieve, which absorbs nitrogen, trace gases, and water vapor from the air. These molecular sieves use inorganic sodium aluminum silicate pellets. These pellets absorb the nitrogen and trace gases and water vapor and provide a concentrated mixture of more than 90% oxygen for patient use. A second method is the use of a vacuum to pull ambient air through a semi-permeable plastic membrane. The membrane allows oxygen and water vapor to pass through at a faster rate than nitrogen from the ambient air. This system can produce an oxygen mixture of approximately 40%. These devices, called oxygen concentrators, are used primarily for supplying low-flow oxygen in a home care setting. For this reason, details about the principle and operation and appropriate use are discussed later. So you'll hear more about oxygen concentrators. Air. Atmospheric air is a colorless, odorless, naturally occurring gas mixture that consists of 20.95% oxygen, 78.1% nitrogen, and approximately 1% trace gases. At STPD, the density of air is 1.29 grams per liter. This is used as a standard for measuring the specific gravity of other gases. Oxygen and nitrogen can be mixed to produce a gas with an oxygen concentration equivalent to that of air. However, medical-grade air usually is produced by filtering and compressing atmospheric air. Large medical air compressor pictured here. The air compressor sends gas to a reservoir at a higher than line pressure. When the preset pressure level is reached, the pressure switch shuts off the compressor. Gas leaves the reservoir and passes through the dryer to remove moisture, and the reducing valve reduces gas to the desired line pressure. When the reservoir pressure has decreased to near line pressure, the pressure switch turns the compressor back on. Also pictured is a small portable compressor used with a handheld nebulizer to aerosolize medication, as you might use in home use. Carbon dioxide. At STPD, carbon dioxide is a colorless and odorless gas with a specific gravity of 1.52 grams per liter. This is approximately 1.5 times heavier than air. Carbon dioxide does not support combustion or maintain animal life. For medical use, carbon dioxide usually is produced by heating limestone in contact with water. The gas is recovered from this process and liquefied by compression and cooling. The FDA purity standard for carbon dioxide is 99%. Mixtures of oxygen and 5 to 10% carbon dioxide are occasionally used for therapeutic purposes. Therapeutic uses also include the management of hiccups, prevention of complete washout of carbon dioxide during cardiopulmonary bypass, and regulation of pulmonary vascular pressures in some congenital heart disorders. However, carbon dioxide mixtures are more commonly used for calibration of blood gas analyzers and for diagnostic purposes in the clinical laboratory. Helium. Helium is second only to hydrogen as the lightest of all gases. It has a density at STPD of only 0.1785 grams per liter. Helium is odorless, tasteless, non-flammable, and chemically and physiologically inert. It is a good conductor of heat, sound, and electricity, but is very poorly soluble in water. Although helium is present in small quantities in the atmosphere, it's commercially produced from natural gas through liquefaction to purity standards at least 99%. Helium cannot support life, so breathing 100% helium would cause suffocation and death. For therapeutic use, helium must always be mixed with at least 20% oxygen. Heliox, a gas mixture of oxygen and helium, may be used clinically to manage severe cases of airway obstruction. Its low density decreases the work of breathing by making gas flow more laminar. Helium must always be combined with at least 20% oxygen. The higher the concentration of oxygen used in heliox mixture, the less likely it is that the heliox would be beneficial. Heliox mixtures of less than 60% helium are rarely used clinically. Nitric oxide. Nitric oxide, or NO, is a colorless, non-flammable, toxic gas that supports combustion. It is produced by oxidation of ammonia at high temperatures in the presence of a catalyst. In combination with air, nitric oxide forms brown fumes of nitrogen dioxide. Together, NO and NO2 are strong respiratory irritants that can cause chemical pneumonitis and a fatal form of pulmonary edema. Exposure to a high concentration of NO alone may cause methemoglobinemia. High levels of methemoglobin can cause tissue hypoxemia. Nitric oxide is approved by the FDA for use in the treatment of term and near-term infants for hypoxic respiratory failure. The American Academy of Pediatrics, or AAP, published a policy statement recommending the use of nitric oxide in the care of term and near-term infants when mechanical ventilation is failing due to hypoxic respiratory failure. The American Academy of Pediatrics suggests that nitric oxide be used before excorporeal membrane oxygenation. A systemic review from the Cochrane database supports the recommendation that inhaled nitric oxide at 20 parts per million may be beneficial in term and near-term infants. Nitrous oxide, N2O. Nitrous oxide is a colorless gas with a slightly sweet odor and taste that is used clinically as an anesthetic agent. It is better known as laughing gas. Similar to oxygen, nitrous oxide can support combustion. However, nitrous oxide cannot support life and causes death if inhaled in its purest form. For this reason, inhaled nitrous oxide must always be mixed with at least 20% oxygen. Nitrous oxide is produced by thermal decomposition of aluminum nitrate. The use of nitrous oxide as an anesthetic agent is based on its central nervous system depressant effect. However, only dangerously high levels of N2O provide true anesthesia. N2O-O2 mixtures are almost always used in combination with other anesthetic agents. Long-term human exposure to nitrous oxide has been associated with a form of neuropathy. In addition, epidemiologic studies have linked chronic laughing gas exposure with an increased risk for fetal disorders and spontaneous abortion. On the basis of this knowledge, the National Institute for Occupational Safety and Health has set the upper exposure limit for hospital operating rooms at 25 parts per million nitrous oxide. Thank you for your time and attention. It's been my pleasure working with you today.